Well, thank you, Kat. I am Dr. Shairi Turner, a physician and the Chief Health Officer for Crisis Text Line. You can think about Crisis Text Line as a mental health emergency room. So whether someone is struggling with depression or anxiety or just sadness, Crisis Text Line is available free 24/7 by texting 741-741. They can receive support from a volunteer crisis counselor.
Awesome. The question that actually just popped in my head, how does that relate to slash differ from 988? I know that's a new like crisis, I guess, line that has been created. What is the
Yeah.
difference and similarities and things like that?
Yeah, so 988 is the 988 is the 3-digit short code for the National Suicide Prevention Lifeline.
Hmm.
Crisis Text Line, in fact, supports and is part of the Lifeline network,
Hmm.
supporting through our text and chat on a separate platform, but still there to support the sure. 988 is a part of the government organization, but
Hmm.
Crisis Text Line is independent of that. And Crisis Text Line is available in Spanish, text, chat, and WhatsApp.
That's awesome. That's really great. That's an option. So going more into depth, what are people in your experience typically how are people typically affected from events like this, shooting emotionally and mentally?
So we hear from thousands of texters every day. We average about 3,000 text conversations per day. And people are struggling, even separate and apart from events like traumatic events like this. We hear from folks who are struggling with fear, anxiety, and whatever these sorts of situations bring up. It's so important that we all validate our feelings and not ignore what it is that's coming up for us when we witness tragedies like this.
Absolutely. That's great. I was a psychology major, so this is all resonating with me. I love
Yes,
to hear
yes.
it. Yeah, it's awesome. So kind of getting more practically into things, what are some everyday strategies in dealing with the emotional, and mental effects from these sorts of tragedies? Just some practical strategies.
Right. So, three tips I would offer to your viewers is
Hmm.
three of those tips are listening to your body. So, where do
Hmm.
you find the discomfort? Are you getting headaches? Are you getting stomach aches? Recognize that that might be your body telling you that this is a real source of stress, and
Hmm.
figure out what you need in the moment. Number two would be to set boundaries. So sometimes we're inundated with the news cycle on these tragedies, and we've got to set those boundaries and be able to say, all right, I'm going to turn off the TV, I'm going to relax,
Hmm.
I'm going to do something that supports me. And you don't have to feel guilty about that, right? It's important
Hmm.
to take care of ourselves in these moments. And last, reach out for support. So you don't have to handle all of this on your own.
Hmm.
There's Crisis Text Line. We are support by texting 741-741, and also reaching out to friends or family members.
It's great. Those are great tips. And I'm sure our digital audience will appreciate them just because people don't know what to do sometimes in
Right.
response to these things. That's great. What do you tell your children or younger family members about these events, and how can parents and others help each other deal with these tragedies?
Yeah. So, first of all, acknowledging that these are very difficult times to be a
Hmm.
parent, right? And
Hmm.
that parents, as they support their children, also need to seek that support for themselves when they need it. But for children, it's really important to acknowledge and recognize that there's confusion, there's anxiety, but it's most important to meet your child where they are, because
Hmm.
depending on their age, they may be too young to even understand. So then in those situations, you don't necessarily have to introduce the topic, but listen to your child and figure out what their what they're seeing, what they're hearing, and check in with them. So you want to, number one, you want to meet them where they are. Number two, you want to check in on what's being said at school or amongst their friends so that you can provide some reality or advice or guidance around what they're hearing and what they're feeling. Number three, validate those feelings. So whatever it brings up for your child, it's important to acknowledge that and let the child know that those feelings are okay to have. And number four, really stay open to having the communication, not just in the moment, because sometimes it takes children days or weeks or months to truly process what they've seen and heard and have additional, they may have additional questions. So it's always important for parents to let their children know that they're always available to talk about it and to hear about the child's feelings.
That's great. Thank you for that. Let's see. So you kind of talked about the crisis text line, but what are some resources to anyone affected, which is most of us, honestly, who may be struggling?
Right. So Crisis Text Line has a partnership with the Tennessee Suicide Prevention Network. So anyone can text TN to 741-741 to be received and supported by a Crisis Text Line volunteer. In addition to that, there's local services. So you can check in with mental health professional for advice or guidance. Your physician oftentimes has local resources, or even school guidance counselors are very much aware of what's available for students and children locally.
Awesome. Finally, when do you think, in your professional opinion, does it reach a point when someone maybe needs to seek longer term solutions, therapy, just seeing a more specialized physician or something like that?
Right. So it's important to get support before things become a full-blown crisis, right? So when we start to feel like we're not ourselves, when we're not quite eating or sleeping or processing things in the way that we otherwise would, that's probably definitely a time to seek professional support. But before you get to that, it's never too early, right? So if you have a therapist or someone who has a good therapist, after seeing or witnessing or hearing about even situations like this, it's okay to check in and get someone's opinion about how you're doing, because sometimes it's easier and better to get that support early or often before it becomes something where someone's engaging in self-harm or trying to hurt themselves, the more obvious need for professional assistance.
Awesome. Well, Dr. Turner, thank you so much. That was some great insight that I'm sure our digital audience and viewers will really appreciate. And I hope to continue this relationship in the future, just in case, we want to do any other stories, any events that might happen, hearing more about your resources in your organization. So that would be great. And thank you again for interviewing with us.
Thank you, Kat.